Good evening, dear friends. Welcome to BMC Global Live Al-HILAL Health World, nothing but lifestyle. As you are aware, this is a talk show with the expert doctors of Al-HILAL hospitals and medical centers. Today we will be discussing about lifestyle diseases, a topic that touches millions of lives around the globe. From diabetes to hypertension, from heart diseases to obesity, lifestyle diseases are shaped largely by the way we live, what we eat, how we move, and how we deal with our stress. And the doctor joining us today is Dr. George K. Antony from Alhilal Premier Hospital, and he is a specialist in internal medicine. So, doctor, welcome to the show.
Thank you, ma'am. Thank you for having me on board.
Thank you for joining us today. So, doctor, what are the lifestyle diseases? How do you describe them?
So, broadly speaking, lifestyle diseases are a group of non-communicable diseases that arise out of one's poor healthy eating habits and poor lifestyle, as the name suggests. So, this could be, like I mentioned, because of poor eating habits, lack of physical activity, unwanted or unhealthy vices such as alcohol and smoking, or it could be just part of the stress that we face in today's day-to-day life. Also, urbanization and modernization has an important role to play in the manifestation of lifestyle diseases.
And what are the common lifestyle diseases you encounter in your OP normally?
So, when we talk about lifestyle diseases, as per the WHO, it has been categorized. So that what immediately comes to my mind is certain cardiovascular conditions, which ranges from hypertension, coronary artery disease, cardiac failures, and also stroke. Along with this, we have the other major diseases such as diabetes mellitus, which is a silent killer, also dyslipidemia, obesity and related conditions such as metabolic disorders. Then we also have various other respiratory conditions which can also be classified in lifestyle disorders such as COPD, which has a close association with smoking. Certain cancers such as breast cancer, lung cancer, and colorectal cancers can also be included in this group. Otherwise, in addition to this, we also have certain other psychological ailments such as depression and anxiety that have found their place in this category. Liver disorders also find a place in this in the group of lifestyle diseases, especially non-alcoholic fatty liver disease, which is increasing day by day nowadays. And also we have the alcohol-related liver disease also. In addition to this, we have something connected with the musculoskeletal system, which is indirectly linked to obesity. So this also is nowadays classified under lifestyle diseases.
Now, doctor, what are the risk factors associated with these conditions you just spoke about?
Okay. So that's an interesting question. So when we talk about lifestyle diseases, the most common risk factors are, as we all know, unhealthy eating habits. In our days, in our childhood, we used to have a home-based diet, but that is not the scenario nowadays when people now resort to fast food, the so-called junk food, because of their lifestyle and also because of the job, etc. So this is one risk. Second would be inadequate exercise. Now they say that most of us are confined to the office jobs. They leave their job, they go home. It's mostly a sedentary lifestyle. And they say that sitting now, we all sit during our work hours. We also follow it up with sitting at home and then sleeping. Sitting is now known to be the new smoking. In addition to this, various other vices which are unhealthy, such as smoking, which is a major risk factor for the lifestyle diseases, and also surplus alcohol intake. So both smoking and alcohol have found they're notorious for causing these lifestyle diseases. In addition to these, various stress and inadequate sleep also play a big role in the manifestation of lifestyle diseases.
Now we would like to know about the statistical significance of the lifestyle diseases.
So when we talk about numbers, it's a good question that you asked. So if we look at it, we see that around 41 million deaths occur globally, right, just from lifestyle diseases. Okay. So this is actually a very big number. And if you look at the total number of deaths that occur globally, lifestyle diseases account for at least 74% of these total number of deaths. So if you have 100 people dying globally, around 75 people are dying from a lifestyle disease. So this is a big number. And also, if you look at the number of obese people worldwide, it's around 650 million. And also diabetic people who are obese, that is around 537 million. So these are not small numbers. So this is why we again and again we emphasize the stress for lifestyle diseases and also the hasty treatment and detection, which is more important. Also, other numbers, smoking kills at least 8 million people worldwide globally annually. Out of the total number of deaths from lifestyle diseases, cardiovascular diseases rank topmost, around 18 to 19 million per year. And when you come to the use of tobacco and smoking, it accounts for at least 8 million deaths per year. And coming to physical inactivity, we see that people who are physically inactive, they are also prone for death, and it claims around 5 million lives per year, roughly. So this is why lifestyle diseases are gaining utmost importance in today's modern world.
Now, why is it so important to know about lifestyle diseases these days?
So we have just discussed about these numbers. We have seen that the number is not small. It's all huge numbers. So having a knowledge about these lifestyle diseases is very important, both for the physician and for the patient alike. So from the physician's point of view, he has to know how to detect these lifestyle diseases in an earlier stage, what to do, what to examine for each patient, so that he can detect these diseases early, educate these patients regarding this entity, and also provide adequate treatment. Also, from the patient's perspective, they have to know what are these diseases, what are the risk factors, so that they can modify their lifestyle in the preferred manner, so that they are not at risk of these diseases. And if they have a strong family history, they are supposed to take additional care so that they are not subjective, they don't become victims to these diseases. So this is why understanding this whole entity in the modern world is very important.
So you are a specialist in internal medicine. What is the role of a specialist in internal medicine in controlling and managing lifestyle diseases?
So the role of an internal medicine specialist is very important. He forms the central core in the management team of lifestyle diseases. But it is not just restricted to an internal medicine specialist. It's a teamwork actually. It's a multidisciplinary team. We have an internal medicine specialist. We have a dietitian who is very important. We have a physiotherapist, and also we can make use of the services of a psychologist. And in cases, we might have to use the help of various other specialists, such as a cardiovascular expert or obesity expert, so on and so forth. It depends on case-by-case basis. So how does an internal medicine specialist deal with a case of lifestyle diseases? So when it comes to the role of a physician in the management of a lifestyle disease, there are 4 steps. One initially is the risk assessment. Second would be patient counseling. Third is about prevention and other measures. And then fourth and the last is public health impact. So we can talk about this one by one. Now coming to the risk assessment. So this is normally the things that a doctor does when a patient comes to me in the clinic. So what are these things? Usually regular BP checking, blood pressure checking for evaluation of hypertension. That is why we check the BP on a regular basis. Then we also check the BMI, that is the body mass index, that is weight by height in meters square. Also the waist to hip ratio, which is an important determinant of obesity. So these are the things that a doctor can check at each of his patient visits. Then coming to the labs. So what are the minimum tests that we do? One is a fasting blood glucose and HbA1c, especially if the patient is over 45 years of age. Then we have the fasting lipid profile, the liver and renal function test, and in certain cases we might also have to do a ECG. So these are the risk assessment methods. Then coming to patient counseling. So we have already discussed this. Counseling depends on the risk factors. So as we mentioned, the risk factors are inadequate exercise, not healthy eating habits, vices, and stress and other sleep disorders. So we have to address them one by one. So coming to the diet, we always stress on the need for a wholesome diet. Avoid processed foods, avoid red meat, use a olive oil based diet, especially what is known as a Mediterranean diet. We also have what is known as a DASH diet for hypertension. So these are some of the things that we can educate the patient regarding. So that comes as part of patient counseling. Then regarding the exercise, that is around 150 minutes of exercise per week. It could be either 150 minutes per week or 30 minutes per day of at least 5 days per week. This can also be continued or extended to at least 300 minutes per week. So this is regarding the exercise. Then managing stress at work. Always maintain a healthy work-life balance, which is very, very important in today's fast-moving, fast-paced world. So that helps a long way. Then coming to the sleep patterns, we always advise the patient to have at least 7 to 8 hours of proper uninterrupted sleep, which also helps in curbing these diseases in the early stage. And then it goes without saying that we have to educate the patient regarding the vices, that is stop smoking. Again, I tell you, stop smoking, because smoking is one of the most dreaded risk factors for lifestyle diseases. If you take any disease, smoking will have a part to play in the manifestation of the disease. So smoking, stop smoking. Limit alcohol. In women and men, the amount is different, which is, we don't have to go into the details for that. And then lastly, we'll have to also educate the patient regarding the general well-being and overall healthy status. This is regarding the counseling. Then we have the preventive methods, which include screening of all these diseases, like we mentioned, the patient education forums, and then vaccination for various diseases, especially certain cancers. We all have vaccination procedures for all these. So these also go a long way in these lifestyle disease management.
So doctor, now can you educate us about the prevention of lifestyle diseases?
So when we talk about prevention, for any disease, prevention is always better than cure.
Yes.
And it goes along, it's more important in the case of lifestyle diseases, because there is a scope for prevention. It doesn't happen all of a sudden. We have a time between the onset of symptoms and the disease per se. So when we talk about prevention, we have the primary prevention, we have the secondary prevention, the tertiary prevention, and prevention at the community level.
Now, can you explain about the primary prevention?
So coming to primary prevention, we have already been discussing it all throughout this talk. It's basically centered around having a healthy diet, maintaining adequate exercise every day, adequate sleep, and most importantly, like I said, avoiding all the vices, especially smoking and alcohol, and combating stress at the workplace and at home, and basically ensuring all-round well-being. So when you talk about healthy diet, we always stress on home-based diet, more of wholesome meals, fruits, vegetables, increased roughage in the diet, and also minimizing processed food, minimizing red meat, the importance of Mediterranean and a DASH diet, which especially is important in the management of hypertension, and so on and so forth. When we come to exercise, like I mentioned, it's about 150 minutes of exercise every week, or people who are active can also extend it to around 300 minutes per week. All these are a case-by-case basis. If the patient has a strong family history, then all these things differ. It will be taken individually. Then we have what we'll have to combat the stress. So for that, counseling and the aid of a psychologist is very important, because a lot of people, we don't know, it's just a tip of the iceberg that we are seeing. But many people are facing a lot of stress from their workplace, and they rarely talk about it. So we need to go spend time with the patient. We have to delve into their problems. We have to know what is troubling them, and we have to take adequate measures. Then again, strictly speaking, limit alcohol, stop smoking no matter what, because these are the two main entities that can give rise to all these lifestyle problems. And it does not give you any joy, but because the joy that is there initially will result in sorrow at the end. So it is better to stop these at the start. Then adequate sleep, like I mentioned, 6 to 8 hours of uninterrupted sleep is very important in the management of lifestyle disorders. So now coming to the secondary prevention, it is basically early detection and treatment if needed. So how do we detect these conditions early? Like I already mentioned, we have some screening procedures. Whenever the patient comes to you, a routine blood checkup. This can deal with the hypertension part. Then various blood tests, such as the fasting blood glucose, the HbA1c, especially for people over the age of 45. But it is worth noting that if the patient has a history of diabetes in the family, we'll have to do these tests at an earlier stage, maybe even before 30 years of age, or maybe even in the late 20s. It's a case-by-case basis. And also checking the lipid profile of the patient every 5 years, which is the current norm. This will detect dyslipidemia. A routine ECG, especially if the patient has family history, we have to do that to make sure that the patient does not have a risk factor for cardiovascular diseases. So these are the ways that we detect these diseases, and it goes without saying. If we are not able to control it just with lifestyle changes, then comes the role of medicines.
Okay.
So in the case of diabetes, we have numerous medications in the market today, various with a lot of range of activity. So in case you are not able to take care of your diabetes just by diet alone, we are there, doctors are there at your service. We can take the help of small dose medications to control your sugars. So is the case with blood pressure and also dyslipidemia. But it goes without saying that prevention is always better than cure. So if you are able to catch hold of these diseases at the start, we can always control them, not with the aid of medicines, but with diet and lifestyle modification alone. Coming to the tertiary prevention. So these are ways by which we can prevent the progression of the disease. For example, a patient with diabetes mellitus, he's got an ulcer on his foot. So that's a diabetic foot disease. So how do you decrease how do you halt the progression of the disease, or slow the progression of the disease? That is by managing the sugars. So this is how we do a timely checkup. This is why timely visits to your doctor is important, so that he can have a look at your blood sugars, he can examine you properly and know what is to be done at that point of time, at that stage of the visit. So this is why we stress on timely doctor visits, especially to your internal medicine provider or your internist or your family care physician, whichever is applicable to you.
Doctor, you already mentioned about community prevention of lifestyle diseases. Can you make it more clear?
Yeah, last but not least, community health-based programs are also very, very important. For example, screening programs in the school. These can educate the children, especially they are the future citizens. So these education measures can also imbibe in them what are these diseases, how they can be prevented, and what can be the possible solutions. Similarly, public health campaigns, they go a long way in the control of these lifestyle disorders. So also campaigns at the workplace. All these things play a very important role in the control of lifestyle disorders.
And doctor, what is your advice for our viewers regarding lifestyle diseases?
Even though we had a small conversation regarding lifestyle diseases, the magnitude of the problem is looming large. The numbers are on the rise. Every day, more and more people are getting affected by diabetes, hypertension, various cardiac ailments, and stress disorders. So what is the solution for all this? As an internal medicine physician, the only thing that I have to tell you is, like I mentioned, follow a proper diet, engage in active physical activities every day, limit your vices, be it alcohol or smoking. And smoking, I repeat, stop smoking is the need of the hour. And also avoid stress and ensure that you have a very healthy and uninterrupted sleep for at least 7 to 8 hours. This goes a long way in curbing these disorders. I hope you all stay healthy. If you have any queries, we as physicians are there at your doorstep to help you.
And doctor, finally, what do you have to say about Al-HILAL Healthcare Service?
The Al-HILAL Group is one of the fastest growing networks in the healthcare industry, especially in Bahrain and the Middle East. So when you talk about healthcare, we have our 10th branch that has opened recently, that is the Alhilal Premier Hospital. When I say premier, it means it is affordable care to all the deserving patients. We have all the major specialties there, including internal medicine, general surgery, bariatric surgery, obstetrics and gynecology, pediatrics, and various other major specialties. So we are here to help you. Just drop in and we will address your problems and find a possible solution. Thank you. Have a good day and stay healthy.
Thank you, doctor. Thank you for joining us today and giving us a lot of valuable information about lifestyle diseases.
Thank you, ma'am. Yeah.
So viewers, as doctor now spoke, prevention is always better than cure. As we know, lifestyle diseases are shaped largely by the way we live, what we eat, how we move, and how we manage our stress. But there is good news. Lifestyle diseases are preventable and manageable with the right knowledge and care. So stay happy, stay healthy. Till we meet again next time, this is Jasila Mujib signing off. Good night.